Welcome to Right for Your Health channel. Today I'm going to teach you on how to prepare your body, the correct way to prepare your body for Pilates exercises. And this will involve full body alignment, deep breathing, thoracic breathing, TPA, your core muscles engagement, and your pelvic floor muscles engagement, and also your joint mobility. These exercises for beginners and for those who have been away from Pilates for a long time or from any other exercise and would like to use it as a recovery. And for disclaimer purposes, if for any reason you are experiencing pain, long-term pain, or joint soreness in your joints, or you have an injury, please seek medical advice before starting this exercise. So we're going to start off with our body alignment, and we're going to stand tall. I would like you to stand tall. Okay, legs hip width apart, toes facing forward, neck long, gaze in front of you, shoulders relax, relax your toes, relax your ankle, relax your knees, relax your hips, relax your lumbar spine, relax your thoracic spine, relax your shoulders, relax your arms, relax your neck, and completely relax. Just breathe naturally, no tense in the body. Just breathe naturally and just feel that you are mounting. Just imagine somebody is trying to pull you up with a string, but you want to stand your ground. You want to stay down on that floor. So completely relax. You can close your eyes if you wish, just to concentrate on your breathing. Your breath goes in and out of your body through your nose. Reason why we breathe through your nose is to clear the lungs. You're clearing your lungs and preparing it for the difficult workouts. So just naturally breathe in and out. Feel that balance. And we'll relax. Now we're going to move on to our deep breathing, our thoracic breathing. We are going to breathe through our chest. So I'll ask you to place your hands on your ribs, like so, fingertips facing each other, with your heel of your hand on your ribs. And as you take a deep breath in, just have a deep breath in, filling your body with air like you're doing to a balloon. And as you do that, your fingertips draw apart. And when you breathe out, your fingertips draw together. Breathing out, emptying that air out of your body. Breathe in, breathe out. We're going to do this 3 more times. And breathe out. Deep breath in through your nose and out through your nose. 1 more time. And out through your nose. And relax. Now we are going to move on to our deep core muscles, which is our transverse abdominis muscles. These muscles are very important during the exercise that we need to engage them. Engaging them is not just only for the exercise, but we're engaging them just for strengthening and to help us move into the poses, the difficult poses, much freer, and also to avoid injury to your spine. So we're going to practice this TPA engagement, or your deep core muscle engagement. I'll ask you to take a deep breath in through your chest like we did earlier. Deep breath in, and as you breathe out, at this time, you just pull in your abdomen. Pulling your abdomen all the way, you're breathing out, pull it in towards your spine. Breathe out, breathe out, breathe out, and relax. To make it easier, I'll ask you to open your legs a bit wider than your hip. a little bit wider than your hip. Bend your knees like so. I've got to turn to show you. Just bend your knees slightly. Bend your knees slightly, right? And we're going to breathe in. Take a deep breath in through your chest, And as you breathe out, bring in your abdominal towards your spine. Bring it out, breathe out, bring it in, and you relax. Just relax, and breathe naturally. We're going to do this 2 more times. Deep breath in, and as you breathe out, pulling your abdominal wall muscles towards your spine, and hold that engagement. Breathe through your chest. Breathe in through your chest, keeping the focus on your abdominal muscles engagement, and breathe through your chest. Breathe in and out through your chest, and relax this engagement. We'll do this 1 more time. Deep breath through your chest, filling your chest with air, and as you breathe out, bring in your abdominal wall muscles towards your spine. Breathe out, and hold. Hold that engagement and breathe through your chest. Breathe out. Breathe in once more and breathe out, and relax your abdominal muscles. So this is important. As we do this, we're going to be doing this exercise when we're ready to go through our difficult poses, which will be in the next video. Right? So now we're going to move on to our pelvic floor muscles. Right? So I'll ask you to stand tall again with your legs hip width apart, toes facing forward. And we're going to imagine that your pelvic floor is an elevator. So when you breathe in, I would like you to imagine that you're taking your tailbone through your legs up to your forehead. So your forehead will be the elevator, will be the floor of the elevator. Right? So we're going to take a deep breath in through your chest again. Deep breath in. And as you breathe out, tilt. I'm going to turn. You tilt your tailbone. You're pulling your tailbone in, tilting. And you bring your tailbone up to your forehead as the 10th floor. Just feel that. Don't squeeze your bottom. You're just bringing your tailbone in up to the 10th floor. And you breathe. You relax to the 5th floor. Relax the engagement to the 5th floor. Breathe through your chest. Concentrate on your engagement, but you are breathing through your chest at this point. Your tailbone, your pelvic floor is on the 5th floor. Then you relax, release to the 3rd floor. Then release to the ground floor and just relax. We are going to do this again. Take a deep breath in. And as you breathe out, tilt, bringing your tailbone up, breathing out to the 10th floor, and hold. Feeling your chest, breathe through your chest. You hold its engagement, and you breathe into your chest. Deep breath in through your nose, deep breath out through your nose. Deep breath in through your nose, deep breath out through your nose. Then release the engagement to the 5th floor. Let's say your 5th floor is on your breast area. Release that engagement and hold. Breathe in through your chest. Breathe out through your chest, through your nose, sorry. Breathe in through your nose and breathe out. And then you release the engagement to the 3rd floor. You're releasing that engagement to the 3rd floor, and you hold. Hold this engagement and breathe through your chest. Breathe out. Breathe in and breathe out. Then you release to the 2nd floor and hold that engagement at the 2nd floor and take a deep breath through your chest. Keeping the focus on the 2nd floor. in and out. Then relax, keeping the engagement on the second floor. Relax your knees, stand tall, keeping the engagement on your second floor. Continue breathing naturally. So I've now taught you the 30% engagement, which is the third floor, and now your pelvic floor is on 20% engagement. So you are at a 20% engagement. So you have engaged your pelvic floor muscles, and you can release that engagement back to the floor and relax. Right? So now we are going to move on to our joints. We're going to mobilize every joint in our body. So we're going to start off with your neck and your head. Right? So take a deep breath in through your chest. And as you breathe out, you tilt and engage your core muscles, tilt your pelvic floor muscles, and you turn your head to one side. Ensure your feet is hip width apart, toes facing forward. Turn your neck gently towards one side. You're facing over, or you're gazing over your shoulder. And as you breathe back in, you come back to the center. Breathe out, tilting. Turn your head to the other side. Breathe in, back to the center. Breathe out, onto the other side. Breathe in, back to center. Breathe out, onto the other side. Breathe in, back to center, and relax. We are still working on our necks. We're still working on our necks. Deep breath in, and as you breathe out, take your neck to one side. I'm on my left, so you can do your left or your right if you wish, but gently bend your neck, your head onto one side, feeling a stretch. But we're not going through stretching at the moment. We are just mobilizing. Then you breathe back up to center. Deep breath in, breath out as you move. Always remember, you take a breath in first, then as you breathe out, you move your body. Breathe in, back to center. Then we'll take a breath in, breath out, chin towards your chest. And then you breathe in, head back up. You breathe out, we're going back. Don't take the neck all the way back, just gaze forward. Gaze up. And then you breathe up, back up. Breathe in, back up. Then we're going to rotate the head, those who can. If you are unable to rotate your head, please just do the yes and no direction gently. So we take a deep breath in, and as we breathe out, you tilt your neck, chin towards your chest. Then you roll, breathe in. While you roll, you breathe in, breathe in. On to the other side. And as you breathe out, you take the neck down towards your chest, breathing out, breathing out. Then we'll do this the opposite direction. Breathe in, opposite direction, those who can. And as you come to the other direction, start to breathe out, keeping your engagement while you do this. That way you are avoiding injury and you are aiding the flow of your joints. Right? So now we have done this bit. So we are going to move on to our shoulders. We're going to do some shoulder shrugs. So take a deep breath in, and as you breathe in, take your shoulders up to your ear. You breathe out and relax your shoulders down to your back. You breathe in and you relax. One more time, breathe in up to your ear and you relax. Gliding the breath down towards your back, your shoulder blades in your back, and you relax. Now we're going to do shoulder rolls forward and backwards. So breathe in, take your shoulder forward towards your chest. Breathing in towards up to your ear, and you breathe out, gliding your breath down towards your back. Breathe in forward towards chest, up to your ear, and you breathe out into your shoulder blades. Breathe in up to your ear, and you breathe out towards the shoulder blades. One more time this direction. Breathe in and you breathe out. Now we're going to do the other direction. Breathe in from your shoulder blades up to your ear, and you breathe out towards your front. Breathe in and you breathe out. Breathe in and you breathe out. One more time. Breathe in and you breathe out, and you relax the shoulder. We are still working on our shoulders and our arms, so we're going to ask you to breathe in and raise your hands laterally in line with your shoulders, fingertips facing the wall or wherever you are standing. Fingertips face laterally, right? And we are going to work on our wrist and our finger joints. I hope you can see me. My space is a bit small, so I hope you can see me, right? So we're going to work on our fingertips and our wrist. So we're going to rotate, engaging this area, engage your pelvic floor, engage your core muscles, and we're going to focus on our breathing while we rotate our wrist in one direction along with your fingers. So we're working the joints. We're mobilizing all our joints, finger joints, wrist joints, one direction. Now we're going to reverse the direction. Same movement, reverse the direction. Breathe naturally through your chest. Engage your core muscles and your pelvic floor muscles. And we're going to relax your wrists and your fingers, keeping the arms up. Keep your arms up. Now we're going to bend your wrist. Keep allowing your palm of your hand to face the wall away from you. Fingertips facing the ceiling. We're going to do some shoulder rolls or shoulder circles, I would say, right? Keeping the engagement, breathe into your chest as you roll your shoulders, small circles. We're going to do 5 circles. One direction. Then we're going to increase the circles, widen the circles, same direction. Breathing naturally through your chest, keeping your engagement in your core while you move your arms. And we're going to reverse the circles, keeping the wide circles, reversing in the wide direction. Wide circles, opposite direction, wide circles. And then we're going to slow. We're going to decrease the circles, smaller circles, the same direction. And you relax the arm. So we have worked our arm, our wrist, our fingers, our shoulders, our neck. Now we're going to move on our hips, our knees, our ankle, our toes, and our spine. So I'm going to ask you, hip width apart, keep your legs hip width apart, right? Those who have a chair or a wall like me, you can hold on to the back of a chair or a wall to raise your legs, right? So take a deep breath in, and as you breathe out, engaging your muscles, engage your core, engage your pelvic floor, slight tilt in your tailbone, and you raise your leg up. Those who can, raise your knees, bend your knees up, keep it in line with your hips, like so. Line with your hips, right? Now we're going to work on our hip joint. So as you breathe in through your chest, you breathe out, open out your hip, or open out your leg, open out your hip. Breathe back in, breathe out, breathe in, breathe out, keeping the engagement. Breathe in, breathe out, breathe in one more time, breathe out, breathe in, and relax. If you wish, you can relax your leg down for a minute or a second. We're going to work on our knees. We're going to work on our knees. So raise your leg up to 30-degree angle or 45 if you wish. We're going to breathe in, and as you breathe out, extend your leg. Keeping the leg off the floor. Breathe in, extend. Breathe in. We're working our knees. Breathe, extend. We are warming up our joints to prepare for difficult workouts, or just to prepare for your daily activities as well. Right? One more time. And you breathe back in. Up. Okay, now we're going to move on to our ankle and our toes. Breathe into your chest. Breathe out. You breathe in and out. While you rotate, just naturally breathe in and out through your chest while you rotate your ankle one direction. You wiggle your toes while you do this. You're mobilizing your toe joints, warming up, allowing the flow of blood through your joints. Then you reverse direction, reverse direction, reverse direction. Wiggle your toes and you relax. We are still on our leg, we're still on our hips. We're going to do some circles. So we are going to be exercising our body in the 3 range of motion, which is your sagittal, your transverse, which is run around, and your frontal, which is lateral. So now we're going to do circling of our hips, then we'll move on to the lateral. So we're going to raise, keep it the engagement, breathe into your chest, raise your leg up, lean onto one side. Those who have a chair or wall like me, you can lean onto one side. Those who are strong enough, just keep your hand on your hips, your opposite hand on your hips, and lean onto the supporting leg. And then we're going to roll, keeping the engagement in your core and your pelvic floor. Roll to one direction. Breathe in through your chest. Roll. Breathe in and out through your chest as you roll. Circle your hips. We are working on the hip joints. Circling the hip, warming up the joints, and strengthening the joints as well. Now we're going to reverse this direction. Keeping your ankles plantar flex, which is your toes towards the floor. And relax the leg. Keeping the leg up. Those who can extend, we're going to do lateral raise of your leg. So we can, because of my space, I'm going to turn this way, right? Leaning on the supporting leg, keeping your engagement, raise. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. And relax. We're going to work on our opposite leg. Doing the same exercise that we did on this leg. So, deep breath in to your chest. Breathe into your chest. And as you breathe out, tilt, tilt, and raise your leg. Knees in line with your hips. Breathe out, open out your leg, breathe in. Breathe out, breathe in. Breathe out, breathe in. Breathe out, breathe in. Okay? Keeping a balance like me. Balance. Breathe out, breathe in. One more time. Breathe out, breathe in. And relax. Relax your legs onto your toes just for a second. Then we're going to raise to a 30 or 45 degree angle. We're going to work on our knee joints. Breathe out, breathe in. Breathe out, keeping the engagement. Breathe into your chest. Breathe out, breathe in, breathe out, breathe in, breathe out, breathe in. One more time, breathe out, breathe in, and relax. Relax the leg just slightly, but keeping your feet, your foot off the mat. We're going to work on our ankle joint and our toes. Circling in one direction, wiggling your toes at the same time. Breathe into your chest, keeping the engagement. And reverse the other direction. And you relax. Completely relax. Now we're going to move on to our spine, our lumbar spine and our thoracic spine. We're going to move into that mobility. So we're going to stand tall again, hip width apart. Just naturally breathe. No tensing at the moment. No engagement. You take a deep breath in through your chest. And as you breathe out, you tilt your head, tilt your chin towards your chest, bringing your tailbone in, engaging your core muscles, engaging your floor muscles, and you roll. Roll your body down like a wheel, vertebra by vertebra. Relax your knees as you roll. Relaxing your knees as you roll. Relax. The core engagement or pelvic floor engagement is to help you fold your body without any injury or difficulties. Just keep your head hanging, your hands, your arm hanging, hands wiggling, your fingers are wiggling. Then you take a deep breath in, you straighten your leg, straighten your knees. Deep breath out, relax your knees, bend your knees. Deep breath in again, straighten your knees, keeping your body down. Breathe out. Now we're going to go back up to standing. Breath in, and as you breathe out, you're breathing out, coming up. Your knees, your ankles relax, your knees relax. Then your hips, then your lumbar spine, then your thoracic spine, your shoulders, your neck, and your head is the last to come up. We're going to do this twice more. Breath in. As you breathe out, relax your knees, bend your knees, bring the body down, vertebra by vertebra, down to the floor, down. Those who can touch the toes, touch your toes. If you are unable, just keep your hand hanging. Keep your hands hanging. Then breath in, and as you breathe out, you roll the body back up. Ankles first, then your knees, then your hips, then your lumbar spine, keeping a tilt, keeping engagement, then your thoracic spine, then your shoulders, your arms, your neck, and your head is the last to come up. We'll do this one more time. Breathe in. As you breathe out, relax your knees, start to bend your knees, rolling the body down, keep an engagement in your pelvic floor to allow you to roll. Roll the body down, roll down, all the way down to the floor. Those who can, come up onto your all fours. Your wrist in line with your elbow, your shoulders, and your knees in line with your hip. Knees or thighs are hip width apart, right? All fours. And we're going to still work on our spine. Let's work on our spine. As you inhale, you tilt. I need you to see me, how I'm tilting, right? Fully box, and inhale, tilt. Bringing your neck up, creating an arch in your lumbar spine. And as you breathe out, you pull in your head and your neck and your tailbone in as a cat stretch. You breathe in, tilting head up, and you breathe out. We're mobilizing our spine to ensure that we are creating a good posture, and we are protecting our spine while we do the difficult poses. Breathe out. Now I want you to hold that pose, hold the engagement, hold this way, and breathe through your chest. Deep breath in, keeping the engagement. Deep breath out through your chest. Deep breath in and deep breath out. And you relax. Relax. Now we're going to sit. You don't have to turn. I have to turn because I want you to see me, because my space is so small, but never mind. The exercise is the important thing. Now sit back onto your heels. Walk your hands towards your knees. Sit back onto your heels. Come up onto your toes. If you can see me, come up onto your toes. We're going to go back up to the standing. Right? Inhale. Roll onto, and then as you exhale, taking your body back up. Ankles. Knees. Hips. Lumbar spine. The thoracic spine. Your shoulders. Your arm. Your neck and your head is the last to come up. Deep breath in, arms up overhead, palms facing each other or touching, and you breathe out. Breath in, and you breathe out. Breathe naturally and just feel all the air, all the tension off your body. And we have now completed the warm-up. Normally this warm-up exercise for advanced level, immediate and advanced level would be about 8 minutes, but because it's for beginners, I prolong the exercise. But this is a warm-up to help you in doing other exercises. And you're going to see more exercises, more Pilates exercises from Right for Your Health, and hopefully that you understand the preparation of this, of aligning your body and joint mobility. The reason why we do it is to warm up our bodies, to ensure we create a flow and energy, a positive energy in our body, to prevent injury of the engaging of our core muscles and our pelvic floor muscles. It's important that we engage those muscles during the exercises. That way we are able to move our joints, move our, our body freely and avoiding injuries. So I hope you like this, and please click like on this video. Your comments, constructive comments, will be appreciated. Thank you for joining me. Have a Pilates day.